Bismillahirrahmanirrahim. Dear students, today we will talk about diabetes mellitus. These are our objectives. In our lecture today, we will discuss the diabetes mellitus, its definition, types of diabetes mellitus, insulin and its production, where it produced and its main function, sign symptom of diabetes mellitus, and finally the nursing intervention and diet plan for the diabetic patients. So let's start our lecture. First, first of all, we will discuss the definition. Diabetes mellitus is a chronic disease caused by the inherited or acquired deficiency in the production of insulin by the pancreas or by the ineffectiveness of the insulin production. Such deficiency results in increased concentration of glucose in blood, which in turn lead to the damage of many of the blood system, especially the blood vessels and nerves. So, diabetes mellitus is a condition in which pancreas unable to produce insulin. We will just discuss about insulin production and other slides. So we will focus on definition of diabetes mellitus in this slide. So in diabetes mellitus, there is the deficiency of insulin or the cell having ineffectiveness regarding insulin means that insulin cell not recognize the function of insulin. Cell will not respond to insulin. These are the two conditions in diabetes mellitus. Which ones? Either the beta cell not produce insulin or body cell not response against insulin. And what is insulin? Insulin is a hormone produced by beta cell of islet Langerhans in the pancreas gland. And what is insulin? Insulin is a hormone. Which type of hormones? It's a protein hormones. And where it produce in pancreas, in which cells? Beta cells, mainly known as islets of Langerhans. And what's its function? Insulin helps the metabolism of glucose for utilization in the body and store the excess glucose in the liver and muscle as glucagon. And what is the main function of insulin? The main function of insulin is it's convert glucose into glycogen, and this process is called glycogenolysis. Insulin also help in depositing the free fatty acid in the tissue. This is the second main function of the insulin. So in this slides we will discuss about the pancreas, brief anatomy of pancreas. What is pancreas? Pancreas is a long cylindrical organ, most of which is located posterior to the bottom of the stomach. Pancreas has endocrine function and exocrine function as well. Its pancreatic islet cluster of cells that are the cluster of cells which is called islets of Langerhans, which secrete hormones glucagon, insulin, somatostatin, and pancreatic polypeptide. These are the all hormones secreted by pancreatic islets. You see the pancreas, here is its tail, and in the middle, it's the middle region is called body, and the region which is attached to the stomach is called head. So types of diabetes mellitus. There are mainly two types of diabetes mellitus. Number one, the type 1 and type 2. We will discuss type 1. The type 1 diabetes mellitus, the insulin dependent diabetes mellitus. This is also known as insulin dependent diabetes mellitus. Why this is called insulin dependent diabetes mellitus? Because in this condition the pancreas unable to produce insulin. The pancreatic cells, mainly beta cells, not produce enough insulin. And what is it? Its incidence rate 5 to 10% patients have diabetes type 1 diabetes mellitus. And what is type 2 diabetes mellitus? Type 2 diabetes mellitus, formerly known as non-insulin dependent and diabetes mellitus, because in this condition the pancreas, the beta cells of pancreas produce insulin, but the body cell will not produce, the body cells not respond to insulin. Body cell fail to respond to insulin function, and the glucose will be not controlled in our body. 90 to 95% patients have type 2 diabetes mellitus, and the most common type of diabetes mellitus is type 2, and it is mainly occur in adult stage. Here we see the healthy person. His pancreas produce insulin and glucose. Insulin effect on the insulin receptor, and insulin convert the glucose into glycogen. And see the type 1 condition, type 1 diabetes mellitus, pancreas fail to produce insulin. And type 2 diabetes mellitus, the pancreas produce insulin, but the cell fail to respond to the insulin property. Look, here the insulin is produced, but the cell fail to respond to insulin property. Risk factor. What will be the possible risk factor for the diabetes mellitus? First one, number one is diabetes, obesity, race, hypertension, physical activity, family history, and gestational diabetes. These are the all risk factor leading to diabetes mellitus. Clinical manifestation. What will be the possible sign symptom of the diabetes mellitus? The patients having diabetes mellitus will suffer polyuria, polydipsia, and polyphagia. Polyuria, excessive urine, polydipsia, and polyphagia, more than normal eating. Fatigue, patients suffer in fatigue, weakness, patient feel weakness, sudden vision change, the eyesight will be changed, tingling or numbness in hands or feet, dry skin, sore, and that heal slowly, and recurrent infection. These are the all conditions faced by the diabetic patient. Onset of type 1 diabetes mellitus may be associated with nausea, vomiting, or stomach pain, increased blood glucose level. So these are the all clinical manifestation or the sign symptom faced by the diabetes mellitus patient. Diagnostic test. What will be the possible diagnostic test for the diabetic patients? We will do fast plasma glucose tolerance test. Other test is oral glucose tolerance test, mainly known as OGTT, and the most common use is HbA1c, glycosylate hemoglobin. This is the most common test used for diabetes mellitus. Urine analysis, urine for protein, these are the all basic tests for the diagnosis of diabetes mellitus. Management. What will be the possible management for or the treatment for the diabetes mellitus? For type 1, we should administer insulin. And how we administer insulin? By subcut route. Why we not administer or not why we not given insulin orally to patient? Because insulin is basically protein and it is digested in the stomach, digestive tract, and its effect will be nullified. So we will prefer insulin administration by subcut route. We will give insulin to patient through subcutaneous route. And what will be the management for the type 2 diabetes mellitus? We will give oral hypoglycemic agents to the patients, and we will discuss oral hypoglycemic agent in next slide. This is the table of types of insulins. Basically, there are three types of insulin: rapid acting insulin, short acting insulin, intermediate acting insulin. Let's discuss one by one. Rapid acting insulin, these are Lespro, Aspart, and what its onsets of action 15 to 30 minutes, means after administration its effect start after 15 minutes, its effect will be start. And what will be its peak effect? Over 90 minutes. And the other one is Aspart insulin. Its effect will be started, onset will be started at before. After administration, its effect starts, and it takes 20 minutes to start its action. And what will be the peak of its effect? Over 50 minutes. And what will be the duration of its effect will remains for 3 to 5 hours. What is the short acting insulin? The short acting insulin is commonly known as regular insulin, and it is mostly used in hospitals. What will be its onset of action? 30 to 60 minutes. Its action will be started, and its peak will be at 2 to 3 hours, and its effect will be remain 6 to 8 hours. The last one is intermediate acting insulin, commonly known as NPH insulin, and its effect will be started 1 to 2 hours, and its peak value will be 8 to 10 hours, and its effect will be remain in the body 20 to 24 hours. Oral hypoglycemic agents. In type 2, we will give oral hypoglycemic agent to the patient. What are these hypoglycemic agents? Oral hypoglycemic agents are useful only in chronic management of patients with diabetes, type 2 diabetes mellitus. Most commonly used are sulfonylurea, begonides, alpha glucosidase inhibitors, non-sulfonylurea insulin stimulators. These are all hypoglycemic agents given to the patients suffering in type 2 diabetes mellitus. This is the nutritional management for the diabetes. This is a plate. In one quarter, we will place starchy vegetable. and one quarter is filled with lean protein, and the half of the plate will be full with half with non-starchy vegetable. You see, we will prefer to eat fresh food and fresh vegetable and fruits in diabetes. If someone suffer in diabetes mellitus, he will prefer to eat low calories diet, especially eat fresh vegetable and fresh fruits. And the patient also add in its diet in his or her diet the skim milk 1% milk he or she can use in his diet pattern. How we exercise in diabetes. Exercise is very important for diabetic patients. And how we exercise. Before exercise, we will warm up for 5 minutes, and then we will check our blood pressure, the patient blood pressure. After exercise, the patient will be calmed down and we will recheck his or her blood pressure. And why we do exercise in diabetes? To reduce our weight. What will be the complications for complication if someone suffer with diabetes mellitus? In acute stages, the patient suffer with diabetic ketoacidosis, hyperglycemia, hyperosmolar state, hypoglycemia. And the patient also suffer with diabetic foot or diabetic ulcer. There will form a wound on foot, and this condition is called diabetic foot. What will be the complications if someone suffered in chronic diabetes mellitus? The patient with chronic diabetes mellitus will suffer in retinopathy, nephropathy, neuropathy. These are all conditions faced by a patient suffering with chronic diabetes mellitus. At macrovascular level, arteriosclerosis, myocardial infarction, stroke, lower extremities, gangrene will be formed. In which condition? In chronic condition. These are the all complications faced by a patient with diabetes mellitus, either it is acute or chronic. Prevention. What will be the possible prevention for diabetes mellitus? For obese patients, especially those with type 2 diabetes, weight loss is key to treatment and the major prevention factor for the development of diabetes. This is a research done in 2014. And this research 298 people, their age were in range of 20 to 65, and they all suffer in diabetes. The expert took the samples and 149 were put on weight management programs. Out of 298, 149 were put on weight management program. How they reduce their weight? By taking low calories diet, by taking fresh fruits and vegetables, and in step 2 they reduce their weight by exercise. And what will be the result? The result is 46% of the participants who lost weight significantly did not have diabetes. The highest in those who lost over 15 kgs. So, dear students, here the research was done, and the patient weight were reduced, and the result was that the patient's glucose level comes into its normal range. Why? By reducing their weight. So weight management is very important in diabetes mellitus. If someone suffer in diabetes mellitus, he should focus on to reduce his or her weight. Health education. What will be the health education we should provide to the diabetic patient? Assess learning needs. Explain the survival skills, counseling, home care management. We should educate about diabetes mellitus, and we should educate patient about to reduce his or her weight, and we should consult patient families about the diets and exercise as well. Thank you, dear students. If you have any questions, you may ask. Establish.